We're here this morning with Lorie Vincent, who's a long-term patient of mine and a good friend, and she's graciously consented to tell her story to us today and answer some questions. Welcome, Lorie.
In 1999, I had a hysterectomy to remove what I was told were fibroids, and in the pathology found uterine leiomyosarcoma. About 18 months later, during a CT, chest CT, a 4x4 lung tumor was discovered in my lung, and subsequently I had half of my right lung removed about 3 days later. About 3 months after that, I had 2 new lung tumors, and at that time my oncologist said there was nothing he could do and that I should just prepare to get my affairs in order. And in doing so, decided to move back to Wisconsin from Indiana to be with family. By that time, instead of 2 tumors, I had 21 throughout the chest, abdomen, and pelvis. Yep. Went through the MAID protocol for leiomyosarcoma, and 6 months later, clear. And the next recurrence was the time I met Dr. Quinn. And I had 2 lung tumors that Dr. Quinn removed, and then a year later, 2 more that he removed.
Right. And these were with thoracotomies. This was because they were deep in your lung, and
Yeah.
so you'd already had a right thoracotomy.
Correct.
When you had your original tumor removed, and now you're into this realm where you're having recurrent left thoracotomies.
Absolutely. So 3 that Dr. Quinn did.
3 of them right here over a couple-year period.
Yeah, probably about a 3.5-year period, I would say.
So you're the master of having thoracotomies.
After a clear CT 3 months before, the next one showed another about 3.5 centimeter tumor.
Right.
And that's when I saw Dr. Quinn again, and we decided to do Cyberknife.
So how was your opinion as far as having to have this treated without a thoracotomy, at least at that point?
Wonderful. Wonderful. I said, actually, really the only thing that you're going to do is put a needle to place fiducials, and other than that, there's nothing that even touches my body. So after having thoracotomies and chest tubes, it was great. And so those fiducials were placed with the intervention. They basically nicked something, and I coughed up blood for about 45 minutes, I think, after that.
And that lesion treated and appears to be treated still.
Yes, absolutely.
And then last summer, a follow-up serial scan showed a few more lesions.
Right. I think that was my 10th recurrence.
Yep.
That particular one. And actually 3 small lesions, I believe, like right around 1 centimeter each.
Correct.
And that time, again, I saw Dr. Quinn for Cyberknife, and this time he told me about superdimensional bronch. I won't even try and say the whole long name. And
very good.
That was wonderful. Basically, going through the SuperD, I came in at like 6:30 in the morning. Had surgery but was general anesthetic to place the fiducials, and woke up, left by noon, I believe. It was wonderful. And as of the last scans continue to shrink, they're pretty small, 3 to 4 millimeters.
So we're looking good right now.
Mm-hmm.
Lorie, I looked at when I went over your file on our radiologic PAC system, and at least here I see that you've had 65 CT scans.
I believe it.
Since I've known you since 2001. It's just
That's
incredible.
amazing. Yeah, I probably had a few more before that. So there has been an awesome team of oncologists,
yes,
cardiothoracic surgeons, radiation oncologists, general surgeons who have incorporated me as part of my own care and given me a wonderful education of what they're doing and a say in what they're doing, and the willingness to actually sometimes go outside of the lines to treat this rare cancer. But the fact that I'm a over 10-year survivor when I was given 2 years to live when I was first diagnosed is wonderful. And I think it's the hope of continued technology and the the faith I place in my doctors that keep me going.
Sure. It's got to be a lot easier to recover from Cyberknife and a SuperD than a thoracotomy.
Absolutely. Absolutely. Hope we don't ever have to do that again.
I hope not too. Well, I can't thank you enough. You're helping educate physicians and patients, and you truly are an inspiration to everybody.
Thank you so much.
Thanks a lot.